how it is different from men. Diabetes in a woman, usually the woman will have heart problem at very younger age because of diabetes. You compare diabetic and non-diabetic woman, the woman with diabetes have earlier, she will develop heart attack or heart disease. And even compared to males also, diabetic female have more cardiac risk compared to diabetic male. So in that way, diabetes is worst in a female. Not only cardiac, other complications, neuropathy, nephropathy, all are more common and more worst in women. And miscarriage and diabetes in pregnant women, both baby and mother will have. As a cardiologist, we will face many diabetic patients. Most of diabetic patients are cardiac patients. So we will just talk about something about diabetic emergency. Diabetic emergency, usually most of them are cardiac. But if not cardiac, the most common diabetic emergency is hypoglycemia. So I will just tell how to recognize hypoglycemia. Hypoglycemia, one of the dreaded acute complications of diabetes. So usually patients who are on elderly, mostly on insulin people, they are the more prone, and especially renal dysfunction. These are the people who are more risk for hypoglycemia. So what the patient will have symptoms means, usually it will start with fatigue, sweating, and sometimes altered sensorium, and sometimes patients have seizures also, unconsciousness, altered behavior. These are all from the simple sweating to so many complications leading to death also have happened. So very aware of these symptoms. If it is there, then immediately you take some sugar or something, biscuit, chocolate, which is available nearly. Discuss diabetes and pregnancy. Usually most of the pregnant people, they will have a regular pregnancy course without any rise in blood sugar, but some of them will have rise in blood sugar during the course of pregnancy. That is called gestational diabetes. This gestational diabetes means diabetes only during the pregnancy. The diabetes which means the patient was non-diabetic before pregnant, only after pregnancy the patient developed diabetes. That is called gestational diabetes. And this gestational diabetes is a very worrisome thing because you have to have very strict blood sugar control during the diabetes, because it will not only affect the mother, it will also affect fetus as well. So you should have regular consultations with a specialist. Today I am going to give some tips regarding how to handle hypoglycemia at house. Because hypoglycemia is one of the dreaded complications of diabetes, which can be treated very well in the house, provided you should recognize it early. So I have discussed symptoms somewhere else, but now I will discuss only the treatment of hypoglycemia. So not a much big thing. Once you are sure that it is hypoglycemia by glucometer at the house, or you are understanding of the symptoms. So take some chocolates or biscuits, or at least half glass of juice, any sugar containing, any sweetener, whatever is available in the house in the emergency. Just consume that one. Then wait for 10 to 15 minutes. Within that 15 minutes, usually the symptoms will come down. If not, again, repeat the same thing like chocolate or sugar, cake, whichever, whatever is available, sweetener in the house. So usually for 1 or 2 times consuming like this, within 10 to 15 minutes, your symptoms will resolve. This is important. Today I will discuss how the diabetes is different in women compared to men. So usually what we feel is diabetes in women is worst compared to diabetes in men, because diabetes in women, it will have more complications compared to men. Suppose 20-year diabetes in female is worst than 20-year of diabetes in men. Not only cardiac diseases, other eye problem like retinopathy, nephropathy, peripheral neuropathy, atherosclerotic peripheral artery disease, all are more common in women because of diabetes compared to men with diabetes. So women should be care very strict glycemic control to prevent all these complications.